My favorite continuous improvement project for 2017 was starting our total joint program. We started offering our total joint class to patients weekly rather than every other week, and offering more times for them so that they can be better prepared for their surgery. We also started increasing our day of surgery physical therapy evaluations to from 36% last year now to about 80% this year, which helps improve patients, and they have a shorter length of stay, and we have decreased our length of stay by about 6 hours.
My favorite improvement for 2017 is the pathology procurement process. We were having mistakes be made with our specimens, so we implemented a process with the nurse labeling the procedure notes in the specimen in the room, and then bringing out the specimen to one single location in recovery so that we could eliminate mistakes. By checking in that procedure and that specimen, we added the doctor's name, the patient's name, how many specimens, and the nurse checking in that specimen so we could prevent further mistakes.
One of the improvements that we've been working on here at the hospital in 2017 is getting our discharge orders written before 11 o'clock from our physicians. This enables us to, as nurses, get our patients home sooner. It also helps us with our staffing and being able to accept patients from the emergency room as they come. And so this is one of those improvements that we've really worked out to help our patients.
My favorite continuous improvement project of 2017 was one that we worked on with our PBX office. In 2017, we had some reports during our daily escalation huddle that reported that some of our code blue calls were going to the wrong location. As we began to dig into that, we understood that in our public hallways and other areas of the hospital, some people weren't aware of the location that they were standing. And so to respond to that, we labeled each phone with the location within the hospital. So as callers were calling the PBX office, they could be informed to look at the sticker and so that we could call the correct location.
My favorite improvement of 2017 was the First 5. It was a program that we implemented to reduce wait times. We were able to get our door-to-doc time down to 4 minutes, which really helped with our patient satisfaction.
So one of my favorite improvements that we did in 2017 is we were able to 5S our traction room. We were able to get rid of a lot of extra traction equipment that we don't use anymore, which freed up a lot of space for us to organize things so that they were easier to find. We spend a lot less time searching for things and just have more space to, everything has its own designated spot now. Another one of my favorite improvements of 2017 is we were able to go from stocking 1 milligram dilaudid vials to 0.5 milligram dilaudid vials. This allowed us to go from wasting about 8,700 milligrams of dilaudid a year down to about 1,700 milligrams. It also allowed us to cut out more than 8,200 double checks because we were stocking more closer to the doses that we were actually doing.
One of my favorite improvements for 2017 is making the call boxes visible on the parking terrace. One of our roles as security officers is to make sure that caregivers feel safe even out on the parking terrace. These are here to make sure that that happens.
One of the ideas I've been working on at the hospital is trying to decrease the amount of time it takes from when the patient arrives at the hospital until they make it to the CAT scan table. And since we've been meeting that with the ER, we've been able to make that percentage go up to about 80% of the time or more. We've been hitting that door to CT of 30 minutes. So I think by increasing communication, we've been able to know that the patient is over there. We've been able to get the room ready.
One of my favorite projects for 2017 was working with colleagues, surgical services, and pharmacy to implement a efficient drug cart. The present drug cart we had excessive agents in there that we typically didn't use a lot, and by working with pharmacy, we were able to have pre-filled medication syringes to avoid the use of extra dilution, to avoid the use of wasted inventory. We have been able to improve efficiency and flow, decrease drug waste, and basically just improve the safety of our patients.